Good afternoon, everyone. I am Bin Maghari, a BSN Level 1 student at Foundation University. For today's video, I will be going to demonstrate the bag technique. Bag technique is a technique in which a health worker during a home visit can perform procedures in the home with ease and deftness, saving the time and effort with the end viewing of rendering effective health care. Public health bag is an essential and indispensable equipment of the public health nurse, which he or she has to carry along when she goes out for a home visit. It contains with a basic medication and article which is necessary for giving care. Assessment is assess the environment to establish facilities and educate for a bag technique. Okay? To render effective nursing care to clients and or members of the family during the home visit. Principles: the bag should contain all necessary articles, equipment, which may use to answer emergency needs. The bag and the contents should be washed and cleaned as soon as possible. Each supplies being replenished and ready for use anytime. The bag and its contents should be well protected from the contact with any article belonging in the home patient. Consider the bag and its contents clean and or sterile, while article belonging to the patient as contaminated. The arrangement of the bag contained should be in accordance with each sequence, use convenience of the users so as facilitate efficiency and avoid confusion. Hand washing is done frequently as the situation necessitates, and it should minimize contamination of the bag and its contents. If the bag was used for communicable case, the bag and its contents should be approved for clean and disinfected, air dry. The bag technique is done as soon as you get into home and your client. Carry your pH bag in a manner and in state of cleanliness and maintained. Do not swing them on the floor. Use the proper lining. If you have to lay, open your pH bag in a place where it might be contaminated. Periodically wash the cloth lining. Small towels and washcloth, air and dry rest of the bag contains. Contents of the bag: BP apparatus with stethoscope, clamp forceps, pin kelly, bandage scissors, medicine glass, and droppers, test tubes, 5cc or 10cc, test tube holder, auxiliary thermometer, tape measure, functional pin light, white clothing lining, white washcloth, white apron, orange stick, umbrella, and glass container. Upon arriving at the client's home place, the bag on the table or any flat surface linen, paper lining, clean, set, and folded part. Put or strap beneath the bag. Put this bag to the left side of the table to protect the bag from contamination. Put bag handle strap beneath the bag to make a non-contaminated work area. Take out hand towel and soup dish and apron and place them at the corner of the work area. So, assuming I'm done with hand washing, so I put my soap and face towel on the right side of the table. Put on apron right side to the wrong side with piece touching the body and sliding into neatly strap at the back. This is to protect the nurse's uniform, keeping to pieces create aesthetic appearance. Put out things most needed of the specific case. So, this is my thermometer, the alcohol, the med glass, test tubes, droppers, and the med glass. Place waste paper bag outside of your work area to prevent contamination of clean area. Close the bag. Proceed to the specific nursing care or treatment to give comfort and security, maintain personal hygiene, and hasten recovery. After completing the nursing care or treatment, clean and disinfect things used to prevent bag and contents. Do hand washing again to protect caregiver and present spread of infection to others. Open the bag and put it back all articles their proper place. Remove your apron folding away from the body with soiled side folded inwards and clean side outside. Place it in the bag. Fold in the lining plastic, clean, place in the bag and close the bag. Make post-visit to conference on matters relevant to healthcare, taking and conditional notes preparatory to final reporting to be used as the reference future visit. Make an appointment for the next visit, either home or clinic, taking note of the date, time, and purpose for follow-up care. That's all, and thank you.